patients after spinal surgery prefer to think that they should be passive partners in their sexual life. What are your thoughts on this? Do you really think that's true?
No. I think we often get embroiled in this terminology about sort of, do I need to be more passive or can I be active? Or, I mean, I'm not sure that those terms are particularly helpful. I know there's going to be some more content put on here where Bronek will talk a bit more about the biomechanics post-surgery, but ultimately it's very individual. I think we've talked about this already, and it's okay to discuss with your partner whatever position is most comfortable to you. Now, that might be a more passive role, or it might be that actually you're in a more active position, such as the woman being on top or the man coming from behind. It doesn't really matter as long as you approach it with the principles that Bronek will discuss about being aware of the healing tissues, about not adding too much mechanical load or torsional load to stress the healing tissues or the fusion that may have occurred, then actually it's okay to experiment, because what you'll probably find is that different positions will offer different levels of comfort, and that's really what we're looking for. We're looking for a position that's pleasurable for both partners, that is also comfortable, that's not stressing the tissues too much, and dependent on the type of surgery, and as we've talked about before, your previous activity or your desired long-term goals, there will be slight nuances within that.
Yeah. Now, I think it's important for our viewers and for patients to understand that they should not classify, sexual activity into passive or active or being a particular kind of, role player in the whole thing, because it's something between a couple, and they need to sort of identify what's most comfortable for them. Yeah. So, as you said, I think when we get Bronek to talk about the biomechanical aspects and from the surgeon's perspective of what patients can or cannot do, it makes it easy for them to put two and two together. So thank you very much for that.
You're welcome.